Hey there, everyone. We appreciate you staying with us here at CBS News. I'm Errol Barnett.
And I'm Lana Zach. Millions of Americans are under air quality advisories as smoke from hundreds of wildfires in Canada continues to drift south, causing dangerous conditions.
What you're seeing now is a shot of New York City's Central Park in the middle of the day. It's closer to what we saw this morning, and then we saw things really darken toward 1 and 2 p.m. Sometimes you can see through to the green trees, and sometimes they're just not visible. Visibility has been so bad. There were delays of up to 2 hours at New York area airports. For more on all of this, we want to bring in our senior White House and political correspondent, Ed O'Keefe, and Dr. Jay Varma. He is the chief medical advisor at Kroll, a professor at Weill Cornell Medical, and a former medical advisor to former New York City Mayor Bill de Blasio. Welcome to you both. Ed, let's begin with you. Describe for us just what the conditions feel and look like in D.C. and what the White House is saying about this issue. I know they spoke about it at the briefing today.
Errol and Lana, good to see you. Not nearly as smoky here as it is there in the tri-state area, although what you're seeing today to our north is probably what we're going to start seeing a bit overnight into tomorrow here in Washington. The White House saying just a short time ago that the president has, of course, been briefed on this, has actually been briefed on wildfires in Canada for some time as part of his regular Homeland Security briefings, because remember, these fires have been raging since May. What the White House also pointed out is that more than 600 U.S. firefighters have actually been sent over the last several weeks to help fight these fires in Canada. You might think to yourself, oh, really? Where are they from? Well, it's a mix of federal and state firefighters. There's a Northwest Compact between northwestern states and then the western territories of Canada that's existed since 1999. And so about several hundred firefighters from Alaska, Montana, Idaho, Washington State have been sent into Canada to help with this. They return the favor when there are major wildfires in the United States. And then federal firefighting resources from the Bureau of Land Management and the Interior Department have also been sent to assist. This also includes air tankers and other equipment. So that's been ongoing now over the last several weeks. As for the haze and how it could be affecting public health, the White House says that federal officials have been in touch with New York, Connecticut, Pennsylvania, New Jersey, the other states there in New England and the Northeast that are seeing the brunt of this. Michigan as well, because Detroit is also quite hazy today as it was yesterday.
Dr. Varma, I want to bring you into this conversation. The air quality at 2 p.m. was 324. We understand that that's the worst that has ever been recorded here in New York City. Who is most at risk from these dangerous conditions? How long can you safely be outside unmasked? Give us some helpful information that we can actually use.
Yeah, unfortunately, this is a really challenging problem for which it's hard to say that people are going to be protected no matter what they do. Let's go through a couple of really important things. First of all, no matter what your medical condition is, you should really try to limit the amount of time you spend outdoors. Now, remember, most of the air indoors comes from what's outdoors, but of course it gets filtered through, various things that keep your house intact. So that's number one. Number two is if you do have any underlying lung or heart conditions, so that includes kids with asthma, adults with what's called COPD or heart disease, you're going to be at higher risk. And so one of the most important things is to monitor your respiratory symptoms, your wheezing, your cough, your breathing. Make sure you're stocked up on your medication and, get to an emergency department or a hospital if you're having severe trouble breathing. And those masks that, hopefully people got and wore during the height of the COVID pandemic, particularly those N95 or KN95 masks, are really useful. One of the things they're really good at doing is filtering out pollutants. And the last thing I would point out is if you have the economic means to do so, indoor air purifiers can make a really big difference. I actually lived in Beijing from 2008 to 2011, and we had several of them in our homes because, to be honest, it looked a lot like it does in New York most of the time that I was there.
And Dr. Varma, that is a big statement, right? To say that the air quality in Beijing, which is atrocious, is just like what we're feeling and experiencing now in New York, speaks to how bad, I guess, climate change is becoming in all parts of the world, and you're impacted by something happening elsewhere. Speak to us about you mentioned the importance of masking. The particulates of what's drifting along the Northeast appear to be very small, and I guess that's why it's lingering and spreading so far. Speak to us about that component of this danger.
Yeah, this type of smoke has a really big mix of different types of particles, but the ones that scientists are most concerned about are actually the ones that you can't really see in the air. They're known by the name PM 2.5 because they refer to how small these particles, the size of the particles. And those particles can enter your airways and then go through your airways and into your blood vessels. And so there have been a lot of different studies done around the world showing that long-term exposure to this type of air can really increase the risk of heart disease, like heart attacks and strokes. So this is a very real problem, not so much for today, but as the longer this persists here in where we are in New York or throughout the United States, the greater risk people are at. And so you make an excellent point here. This is part of the reason why climate change is a major health issue. And cities like New York are going to have to be prepared for things that, people in the West have been dealing with for quite some time. And that includes making sure people have masks, improving indoor air quality, and improving how we do fire and forest management.
Ed, on the topic of climate change, how does this potentially affect President Biden's environmental agenda?
I mean, if anything, it's sort of just another talking point and a reminder that he's been pushing for this, as has his party, to be as aggressive as possible in ensuring that the world is doing what it can to avoid these kinds of big changes in climate. We should convey one other bit of news that's just come through from the FAA that's flagging not only is this affecting public health, it's now affecting interstate commerce and transportation. There are slowdowns this afternoon at Newark, LaGuardia, and Philadelphia's airports because of low visibility. So the FAA advising that there's going to be a delay as well to air travel, at least in the Northeast. And those are three big airports with connections to other parts of the country. So now this potentially could be very well disrupting transportation and therefore commerce across the country as well. So another reminder of the growing threat of climate change and how it continues to change our lives.
It's just part of this strange new world we're all living through. Ed O'Keefe and Dr. Jay Varma, our thanks to you both.